Morning, guys. Dr. Cook again. Today I'm going to talk about diagnosis of endometriosis. You know, I was introduced to endometriosis 36 years ago. I've seen thousands of women with endometriosis, and the pain and the suffering, I mean, it's crazy, and it's time for this to stop. I was just reminded again with some of the comments recently, with the painful periods. I was told I was weak when I was crawling and crying and could not bear the pain again, and stained my uniform off and never skipped school until I was hospitalized at 16. And then they gave me painkillers, told me nothing was wrong. It was still another 4 years before I was diagnosed. So there's this reputation that endometriosis is hard to diagnose. It's crazy. No. And we talk a lot about getting proper treatment because we want to get our quality of life back. And I can tell you, diagnosing endometriosis is 10 times easier than treating it. So I'm here to set the record straight. As an endometriosis specialist, it is not difficult to diagnose endometriosis. And we're going to take a couple weeks because this is really important. And again, it's not that the general physicians out there are bad or anything. They're good human beings trying. But collectively together as a group, both patients and doctors, we need to work together to get the proper level of care for you guys. So, few basics. So on average, it's 10 years to get diagnosis of endometriosis. No, it's time to stop that. We can do that. We can change that today. In medicine, to diagnose something, we have there's a basic system: screening test and diagnostic test. And a screening test is one where we take a large number of people and do a relatively cheap, inexpensive test, like a pap smear is a screening test. And then we get it down to a smaller group of people where the screening test should pick up most of the people that have the disease. And yes, it's going to pick up a bunch that don't have it and say they do, but then we can go do the diagnostic test to figure out, okay, well, which ones really do and don't have the disease that we're talking about. And so a couple of terms that I think are important. One is sensitivity. So it's ability to correctly identify people with the disease. Specificity is the ability to correctly identify the number of people that don't have the disease. So as a screening test, that's where we start, and that's what we're going to be talking about. So I'm going to go over this a few more times or a few more weeks as far as in detail, and I want to really walk you guys through this, because if I can enable you to get pretty far down the road in making the diagnosis of do I have endo or not, and then as you get into dealing with the physician, what are the things you need to do to make sure they're doing their part, so together you can at least get the proper diagnosis. And once we get that, then we can start talking more about how do we get the proper treatment. So it just, we need to get this corrected now. There's no reason people should be out there suffering pain and all this over year in and year out. So tune in next week. We're going to work through this, and great weekend for all you guys. Take care.